Hi, I'm Callie. I'm a student nurse and I'm going to be demoing how to reconstitute and administer a medication via CIVA pump. I'm going to perform hand hygiene, and normally I would be doing my first check at the Pyxis machine, but for this video I'm going to say that this is my med room. So I have my MAR here and my medication I pulled from Pyxis. My patient is John Smith, that's the right patient, right drug, Penicillin G, sodium, right dose, 3 million units. I have a 5 million unit vial, so I'm going to be needing to reconstitute. The route is IV, the right time is every 6 hours. He hasn't had the medication for 6 hours, and this is an antibiotic, so the right reason would be for an infection. And then I'm going to look at my drug monograph. As a student nurse, I am able to give this maximum single dose, 5 million units. I will be giving 3, so that's safe. Okay, this is compatible with normal saline. And my patient already has a normal saline infusion running. That's good. Going to my CIVA instructions. This will tell me how to dilute. So for a 3 million unit dose, I need a 30 ml syringe. For 3 million units, I'm going to be adding 8.2 milliliters of normal saline to my medication vial to give me a concentration of 0.5 million units per ml. So I'm going to be drawing out 6 milliliters to give me 3 million units, and then I'm going to be diluting that in 24 milliliters of normal saline to give via CIVA, and then over 35 minutes at a normal setting. Just back to my monograph here for a second, and it will just tell me the max rate is 15 minutes, and I'm giving it over 35, so that's completely safe. So now I'm going to be swabbing my vials. That's my normal saline. I'm going to swab that for 30 seconds, let it dry for 15. I'm going to do the same thing with my penicillin. Swab for 30, let dry for 15. Got my 10 ml syringe here that I'm going to draw my normal saline with. 8.2 mils of air. Okay. Into my sterilized normal saline vial. I'm just gonna get all the bubbles out so I'm not getting any air.
So now I'm gonna have to look at my CIVA instructions. So for methylprednisolone, it says I need to further dilute it with normal saline and a 10 milliliters syringe for final volume of 10 milliliters, and it needs to be administered
Once. Over a bubble here.
for 26 minutes.
Okay.
So first, I need to figure out how much medication my patient needs. So if he needs 100 milligrams and we have 125 milligram vial, we're going to divide the 100 by 125 and multiply it by 2, which is the volume, which means we're going to need 1.6 milliliters of this medication. And then if we need the final volume of 10 milliliters of normal saline, we're going to need to draw out 3.4 milliliters.
Perfect. There's just a few notes on the board for you.
Go. I'm going to recap this. Stability. Okay, and then I can just administer or inject this into my medication. before I draw up my medication dose, I'm just going to need to roll this gently so I make sure my med is reconstituted. I don't want to shake it to get any air in. Okay, this is already swabbed, so I'm just gonna get my 6 mils of air. Inject my air in. Okay, now I'm just drawing up my med. Okay. Get out those bubbles. Okay, so I have my 6 mLs there. Gonna recap again. Stability. Gonna do my second med check before I dilute this. So right patient, John Smith. Right drug, Penicillin G. Right dose, 3 million units. That's what I have in my vial. Right route IV. Right time, every 6 hours. Right reason, pneumonia infection. Okay, so then the next thing I have to do is get my diluent. So I'm going to be hanging up a mini bag to draw out my 24 mils of normal saline instead of having to use multiple normal saline vials. Okay. Get my syringe ready. Okay. 24 mils of air is what I need.
Okay, and then
Before I draw that up, I just need to swab.
so we have our patient, George O'Malley.
So I would swab that for 30 seconds, let dry for 15,
And he's receiving it right now at 0900.
gonna inject my air, and doing it this way, as it's hanging from the IV pole, just ensures that I get the normal saline out sufficiently instead of having to fiddle around with it in my hands.
I'm going to be really careful not to lift it, just to make sure it stays down.
Just make sure there's no air in here. I'll bubble that. Okay. That looks good. Take that down. That. Again, recap this. And I'm just going to draw back to 30 mils so that I can inject my med in here.
So it may lead to pretty much. So I'm going to be sure to work on this okay, and that's not.
Okay, so I have my dose in here, my 30 mils. I'm just going to cap that so it's sterile. I have a label made for my syringe with my patient's name, the right meds, the right concentration, the right volume, the date and my initials. So I'm going to bring that as well as my MAR, some alcohol swabs, and my IV tubing, and a label for my line to the bedside. So So as I'm entering the room, I'm doing a safety check, making sure there's nothing on the floor, the bed's at a safe height, everything's running properly. Hi John, my name's Callie. I'm going to be your nurse. I'm going to be giving you your penicillin today for your infection. Can you tell me your name and date of birth? John Smith, 46 years old. Perfect, thank you. And I'm just looking at the IV site here. It's intact, there's no signs of infiltration or phlebitis. The dressing's labeled, so that's good. Everything looks to be running properly. Just checking my med, Penicillin G, 3 million units. Total volume's 30 mils. Half a million units per ml. IV every 6 hours. Labeled well. So then I just have to prime my line. Ready.
I'm actually going to do my third med check. Okay.
So this is sterile right now, so I don't have to worry about that.
Okay. So we have O'Malley. He's receiving methylprednisolone, 100 milligrams.
Make sure my clamp is open.
0900.
I'm going to leave the cap on just to keep this sterile.
So we're going to prime the line.
Okay. No bubbles or anything, it looks good. Okay. So I'm just going to put this into the CIVA pump right now before I hook it up. Okay. And then John, I'm just going to let you know, with this medication, you can sometimes get nausea, vomiting, or upset stomach. So just let me know if you experience any of those symptoms. Okay, got my alcohol here. And this, the Baxter pump can keep running because the CIVA is not regulated by it. I'm going to swab the port closest to the patient.
And then
while maintaining that sterile, open this up, and I'm going to connect it.
And then once it's done, I turn off the gas.
That can continue to run. I'm just going to label my line here so that the next nurse knows when it needs to be changed.
This is just to ensure that their medication happens with their knowledge. And then once I'm done that, I would document, and I would document
And then I'm going to turn it on, and I'm going to set it
That's perfect.
to a normal rate.
Yeah, if you want, yeah.
That was like fumbly. I forgot there was no label here.
Like you literally got everything.
And then the next thing I would do is document, follow up on my patient, come back, make sure there's no adverse signs or symptoms.
You still got
Make sure
it.
the IV site is patent. Make sure I see some of the med going in. And sign my mark.
No.